Hey viewers, welcome back to my channel. So in this video I will share a care plan on chronic cough, and here the subject is child health nursing. So let's start. First, here the biographical information or biographic data. Name, age 11 months, sex female, religion, IP number, ward, general medicine ward, pediatrics, date of admission, name of father, occupation, it's like occupation of father, name of mother and occupation of mother. Then developmental age, here the developmental age is infant, as Miss Trishna Roy's age is 11 months, and we know from 0 to 1 month it is said to be neonate, and from 1 month to 12 month they are infant. Now the diagnosis. So here the diagnosis is chronic cough. Chief complaint: patient have complaints of fever and cough for 3 days. Or you can write here that patient's parents came to the hospital with complaints of fever and cough for 3 days. Then present health history: Miss Trishna, aged 11 months, was admitted to pediatric ward on 18/6/2021 with complaints of fever and cough since last 3 days. Her cough had been non-productive and associated with tachypnea and decreased feeding. Tachypnea means increased respiration. Then past health history: no significant present of past medical history and as well as past or present surgical history. Then family history, and here the family chart. Next, move to the personal history. Patient appears to be lethargic, it's L not T, lethargic, lethargic, and with decreased feeding. Eliminatory pattern or elimination pattern: so here both bowel and bladder movement is reduced. Sleeping pattern: patient have distributed sleeping pattern due to cough and hospitalization. Sleeps for about 9 to 6 hours a day. Then play history: the client likes to play with rattle toys and play with her own hands, legs, and also by observing, listening, and manipulating toys in and around her. Nutritional history: the patient is given breastfeed along with the complementary feed. Normally, baby food is given as complementary feed. So the normally patient is given breastfeed 3 to 4 times a day and complementary feed 3 times per day. Presently, caloric requirement is inadequate due to decreased feeding owing to cough and hospitalization. Then birth history. Antenatal history: under antenatal history, health and nutritional status of mother during pregnancy was adequate. No evident or significant presence of history of illness during pregnancy, such as no history of HTN or hypertension, diabetes mellitus, antepartum hemorrhage. No history of infections such as TB, rubella, and mother received 2 doses of injection TT during her antenatal period. Intranatal history: baby was delivered at hospital conducted by doctor, and she was born at full term by vaginal delivery and without any complication. Now postnatal history: patient had cried immediately after the birth. Then birth weight was 3.6 kg. No history of birth injury, no evident history of unconsciousness, cyanosis, jaundice, fever rash. Then immunization history. You can make here one more column and write their remark and like this I had written given, you can write the given or done like that. Then developmental history. So biologic development, weight 9 kg, length 70 cm, head circumference, medium circumference, respiration rate, pulse rate, blood pressure. Then motor development. Under that, gross motor development. So can stand and holding on, can get into sitting position, sit without support, crawls. So all are yes. Fine motor development. Here plays pat a cake, can put several objects in containers, can hold crayon adaptively, can achieve neat pencil grabs of tiny object. Then sensory development, can tilt head backward to see up, can recognize certain sounds. Language development, can imitate speech sounds, can understand name, can uses fingers to paint at things. Psychological or emotional development, sense of trust versus mistrust, exhibits stranger anxiety and so attachment to favorite objects, egocentrism. Then psychosexual development, oral stage, oral area is the major pleasure seeking region. Now physical examination. General appearance lethargic, body build healthy, mental status conscious, activity unable to do properly due to weakness. Then anthropometric measurement, weight 9 kg, height or length 73 cm, head circumference 43 cm, chest circumference 44 cm. Then vital signs, temperature 101.6 degree Fahrenheit, so here the temperature is increased. Pulse rate 163 beats per minute, respiration rate 56 breaths per minute, SpO2 88%, so SpO2 decreased, BP 97/86 mmHg. Then head and face, scalp is found to be clear, hair color is black with adequate distribution, no evident presence of facial puffiness. Eyes, eyebrows are symmetrical and evenly distributed, no evident signs of infections on eyelid, eyelashes are evenly distributed and curved outside. Sclera appears to be whitish in color, pupils are equally retracting with light, conjunctiva is pale in color. Ear, it is found to be symmetrical in size and shape, no evident signs of discharge or infection is found. Nose, no septal deviation is present, no evident presence of lesions, discharge and epistaxis is found. Epistaxis is nose bleeding. Then mouth and throat, lips appears to be pink and dry, central and lateral incisor eruption. It is the history of teeth. Then no evident presence of lesion in the buccal cavity or membrane. No evident signs of stiffness in the neck or enlargement of thyroid gland, and complete range of motion is seen. Chest, tachypnea is present, so here the respiratory rate is 56 beats per minute. Thorax shape is found to be normal, symmetrical chest expansion or chest movement is present. Breath sound were significantly decreased in the right lower and right middle lobes with diffuse crackles bilaterally. S1 and S2 heart sound is heard. Genitourinary tract, no significant history of congenital anomalies, no evident presence of vaginal discharge, bladder pattern was seen to be normal. Rectum, rectal temperature was 101.6 degree Fahrenheit, perineal skin is found to be intact, bowel elimination pattern is not regular and is to be found reduced. Extremities, then under that upper extremities and lower extremities. So upper extremities, both upper extremities are found to be symmetrical. Complete range of motion is possible in both upper limb. No evident sign of edema, deformity, rashes in both upper arms. Then lower extremities, both lower limbs are found to be symmetrical. Complete range of motion is possible in both legs. No evident signs of edema or cyanosis or deformity is found. Abdomen. On inspection, decreased feeding, rapid surface movement is seen during respiration. Then on palpation, non-tender and relaxed muscle tone is present. On percussion, dullness is present. On auscultation, bowel sound is found to be hyperactive in nature. Back, no significant deformity on spine or back. No evident presence of pain, rashes. Nails are found to be pale in color. No significant signs of infections. Nail beds are normal. Skin appears to be pale and dry. No significant sign of bruises, rashes and edema is found. Then investigation. So here the investigation or test parameters: patient's value, normal value and remarks. Hemoglobin, total WBC count, neutrophil, lymphocyte, monocyte, platelet count, blood culture and CRP. Plans. So assessment. Subjective data. She has been experiencing chronic intermittent cough since birth as verbalized by client's mother. Objective data. Intermittent episode of cough. Cough is non-productive in nature. Tachypnea is present and pulse rate is 56 breaths per minute. Sorry, not pulse rate, it's respiration rate. 56 breaths per minute. Then nursing diagnosis. Then goal. Goal is client will maintain clear open airways and normal respiratory rate. Interventions. Observe sounds of cough as well as nature. Rationale to collect the baseline data. Then assess the use of accessory muscle without flaring. Rationale. Then as the trachea and larynx become inflamed and swollen, a child with croup production, a bark like cough and hoarse, muffled vocal sound. Then perform chest physiotherapy as indicated. Advise increase fluid intake and maintain IV fluid prescribed by physician. Then place the child elevated in a semi-Fowler's to high Fowler position and repositioning frequently. Second care plan. So subjective data is he has been coughing since last 3 days and as verbalized by the patient's mother. Objective data: chronic intermittent cough, episode of cough, tachypnea, SpO2, BP and respiratory rate. Here the nursing diagnosis. Goal is client will maintain adequate ventilation, and interventions: assess pulse, respiration and auscultate lung sounds. Monitor SpO2 using pulse oximeter and assess ABG, arterial blood gas as ordered. Then observe changes in level of consciousness, LOC. Then allow adequate rest period and stress the importance of keeping child relaxed by cuddling, and administer humidify supplemental O2 via tent or hood as prescribed by physician, and administered medication as prescribed by physician. Here the rationales. Implementation. Evaluation. So here the evaluation is SpO2 level is low, patient is conscious, patient is calmed and SpO2 increased. Here the respiratory rate is normal, not increased. It is the third care plan. Subjective data: mother said that my baby is always refused to eat feed. Objective data: decreased feeding, intermittent episode of chronic cough. Nursing diagnosis, and the goal is patient will display effective interventions: give frequent small feeding instead of large meal, avoid very hot and very cold feeds, give frequent oral care, removed expectorated promptly, then consult dietitian to provide easily digestible and nutritious food. Care plan, and this is the fifth one.